Right, last one on children. Preliminary observation on Omicron experience in children. Under 18 have a 20% higher risk of admission when infected with Omicron compared to Delta. So children are more likely to be admitted to hospital under the age of 18. Also increased admission in children under the age of 5, so this is higher than Delta. Is this a particular concern? Yes, it is. The relative risk is higher, but as we'll see, the absolute risk is not as bad, but children are more likely to be admitted to hospital than with previous waves. We don't have a precise figure for the under the age of 5, but we know it's higher. This is a concern. Many are incidental discoveries in hospital, though. So most of these children are not admitted. The vast majority of these children are not admitted. So there's a lot of children coming into hospital with various things in South Africa at the moment. And many of them are found to be Omicron positive when admitted, but they were not admitted for Omicron complications. That is the reassuring thing about this. But bear in mind, children were 51% less likely to test positive for COVID-19 relative to an adult. So children less likely to test positive in the first place. But if they are, there's slightly higher risk of being hospitalised. Now, when children did require admission, on the rarish occasions that they required admission, bronchiolitis, inflammation and blocking of the small airways, the bronchioles, pneumonia, inflammation and blockage of the filling up of the alveoli, and also, interestingly, severe gastrointestinal symptoms resulting in dehydration. So we need to look out for severe gastrointestinal symptoms in children that are poorly as well and consider Omicron as a possibility.
All right, children COVID. This is good news. We heard from the CDC director, Rachel Walensky, no concerns about myocarditis with nearly 5 million children vaccinated. I think this is something that a lot of people have had their eye on, and there was a recent Nature publication looking at myocarditis. It really looks like this lower dose that we're giving to the younger individuals is working out well. We're not seeing concerns with myocarditis. I think this just speaks to the importance of thinking about your target population for the jab. Pfizer looks like it is a safer mRNA choice in younger individuals, particularly with respect to the myocarditis risk. That being said, case rates are rising in children and vaccination rates are dropping. So not great to hear. I do think it's important to be thinking about how we approach kids coming in with COVID-19. And as we talked about last time, if you're thinking about monoclonals, particularly in areas where we think the monoclonals are still effective, the Eli Lilly product was dropped down to newborns. So still have that as an option. Timing does matter. And so I want to share a story. So this is my timing matter reminder. So one of my colleagues reached out to me, actually it was just today. And this is a story of a 15-year-old girl, starts to feel poorly, goes ahead and gets a PCR that is positive for COVID-19. So symptoms start Sunday, a little bit of a resulting delay, but now we've got this positive PCR. We got it yesterday. This 15-year-old girl has juvenile idiopathic arthritis. She is on immunosuppressive therapy with methotrexate and Remicade, right? So both T cell and B cell function deficient, and has a high risk for bad outcome. So the physician goes, and there's a way for one of our local large healthcare systems to submit an application online to get this individual set up for antibody infusion. They get approval today, but they're not scheduled for their appointment until Saturday, the 18th of December. So not really a great solution. That individual actually went to one of our local places where they could get it today rather than waiting. So remember, as we've gone through those studies, those delays impact the efficacy of monoclonal therapy. So even though we say you have a 10-day window, the first 3 days is the most effective. The next 6 days continue to be quite effective. If you get past day 6, your efficacy drops in half compared to giving it in those first 6 days. Never miss an opportunity to test. What about those serology tests? What about using them for reinfection? So what about individuals who have been infected before? How do they know about their infection risks? Is this being tracked? And I did want to share that the CDC is tracking this information. There's actually a page Science Brief SARS-CoV-2 infection induced and vaccine induced immunity. So we are interested in how people who've been infected before are doing. And there's a quote I'm going to take from there, and then I'm going to share a story. Multiple studies have shown that antibody titers correlate with protection at a population level. However, data are presently insufficient to determine an antibody titer threshold that indicates if an individual is protected from infection. At this time, there's no FDA authorized or approved test that providers or the public can use to reliably determine whether a person is protected from infection. And they also have a section, comparison of infection and vaccine-induced immune responses. So this is evolving. It's being tracked. We are interested. We are hoping that people who have been infected before are less likely to get infected again. But let me share a story. I got this call earlier today, busy day. And this is a woman who is a healthcare worker. She was initially infected in March 2020, so right in the early days, had COVID then for the first time. But she decides, instead of getting vaccinated, she's going to track her antibody levels. She's testing them regularly. They continue to be very high. As my wife asked, who's paying for all those antibody tests? I guess our insurance companies are. So she's feeling good. She's got this high level. She decides not to get vaccinated. She is planning on getting pregnant, but she is going to an OB and doing in vitro fertilization. The day before that in vitro fertilization appointment, she isn't feeling well, and she is required to get tested by the OB. And lo and behold, despite her very high antibody levels, she ends with COVID this second time. She gets monoclonal antibodies. I'm not sure what the indication was, but she does because she's not pregnant at this point. So now 90 days pass, but she's still tracking those high antibody levels. She's now pregnant. She somehow gets an OB to write her an exemption letter saying that because she is pregnant, she shouldn't get vaccinated. And now today I get a call because she again tested positive for COVID. So I just want to point out, and this is a perfect example, because people want to go ahead and they want to draw those serology tests. They want to feel like if those levels stay high, that they're not going to end up getting reinfected or infected post-vaccine. But clearly, as we keep sharing here, we are seeing, and we are getting this reported in the thousands, reinfections, reinfections, and now even reinfections. So fourth infections in less than 2 years. This looks like this young lady has had her third infection in the last 2 years.